Hi, Christopher Westfall here with the Senior Savings Network with some updates about Medicare. Two things you might want to be aware of. One, a news release from the Center for Medicare and Medicaid Services about how many people are actually benefiting from Medicare. The second one, though, is very interesting. It says that 4 out of 10 seniors that are on one particular type of Medicare plan are completely confused and bewildered about what they have. I've got the solution as to why that's happening and what you can do about it. It means education, and that's why I'm here on this free YouTube channel to educate the world about the world of Medicare from the way that we've seen it. I've been in the industry for 26 years as a licensed agent. There are two different parts of Medicare, two different ways you can go in Medicare. When you turn 65 or later, you're leaving an employer plan, you've got a big decision to make. Now, if you watch all the TV commercials or the large print or the billboards, you'll think that there's only one way to go. And that's why all the agents are pushing everybody toward the one way to go. And there's only a little voice in the wilderness crying out saying, no, there's another way. And that's why I've built this business called Senior Savings Network, where we help people all across the country to look at their options and in no charge to you whatsoever, help you enroll in the best thing that fits your needs. But I want to share with you new numbers from CMS. That's the Center for Medicare and Medicaid Services. As of the end of 2021, these are the new numbers about how many people are on Medicare and the two different types of Medicare. Usually they don't break this out. They did this time, and I think it's very interesting. In total, 62.4 million people are on Medicare. Then they broke it down. 36.2 million of those people chose to remain in original Medicare. And I'll share with you the difference here in just a second. So 36.2 million are still in original Medicare. That's what they've earned and paid into their entire lives. 28 million of those people are not still in original Medicare. They've signed up for the free or the privatized Medicare Advantage plan. Some are paid plans, they're like PPOs and MSAs and others, but for the majority, those people are on Medicare Advantage, taking advantage of the HMO part of the network. So you've got a split here. You've got the majority of people still in original Medicare, some with a Medicare supplement, and that fills the holes of original Medicare so that you're not responsible for a huge 20% of all the outpatient charges as you would be on original Medicare if you did not have a Medicare supplement or Medigap plan. That's the big majority. And then 28 million, again, are in those private plans. So what is the difference? On original Medicare, again, that's the original plan that you've paid into your entire lives. There are no hospital networks. There are no doctor networks. There's no referral required to go to a specialist. There's no prior authorization required to get a surgery or something done. Original Medicare is typically known as the best kind of insurance you could possibly have. However, it's got some holes in it. The biggest of which is on original Medicare, Part B of Medicare, that's the part that pays for outpatient things, only pays for 80%. So most people will get a Medigap or Medicare supplement plan to pay for that other 20%. And doing so is not free. Those plans actually have a premium to it. But knowing that you've got original Medicare with the freedom and then the Medigap plan to fix the holes, knowing then that you can travel, you can go anywhere in the country, you can go to any doctor, any hospital that accepts original Medicare, which is just about anybody, that's the freedom that, again, the majority of people want to go for. However, the little caveat that most people don't tell you is after your open enrollment period, that's your individual open enrollment period, not the one that they say happens every year. This is your initial election period for Medicare. That's within 6 months of your Part B start date. The world is your oyster. If you're on original Medicare, you can choose any Medicare supplement, Medigap plan that you want, and they cannot reject you. So that's great. However, if you give that up, that initial election period, and you give that up and you go either without a Medicare supplement, and you just let it go, or you go to a Medicare Advantage plan, it may then be impossible to come back into original Medicare with a supplement later. That's because most states allow the insurance companies to ask you health questions and consider pre-existing conditions if you're going to get a Medicare supplement after your open enrollment period has happened. Now, if you're still in good health, we can help you. I've got a website that goes through all of that. It's called seniorsavingsnetwork.org/underwritten. That's because you have to go through underwriting. It's just merely some health questions to change into a Medicare supplement plan or to change your Medicare supplement plan, which you can do all through the year. That's original Medicare. It costs more. You have to pay a monthly premium, but it's freedom. to go anywhere you want to. And sometimes you'll have to qualify for it if you did not secure it when you were new to Medicare. The other side of the world is the only thing that you're hearing from Joe Namath, Bill Shatner, J.J. all the famous people that are out there, Bill Engvall and all the rest, highly paid endorsers to get you on one of those free plans where they manage your care. Now, just a minute, I'm going to show you the study from the Office of Inspector General about these plans and where the profit motive may impact your ability to get health care. It's not me saying it. It's not my opinion. I'm not anti anything. I just want you to know the facts that you're not going to hear from the agent who knocks on your door to sell you a Medicare Advantage plan, because that's all they've been trained on. I've got proof of that here in just a second. So on Medicare Advantage plans, you do typically have a hospital network, especially the HMO plans, which is the vast majority that people are signing up for because of their zero premium. You've got a doctor network. Either one of those can change anytime during the year. Many seniors will complain once they've signed up for a Medicare Advantage plan that they thought they picked a doctor, and that doctor was always going to be their doctor in the plan because they've liked that doctor for years. Well, that doctor can opt out of that network whenever his or her contract comes due, and that's not the same period of time that you're having a contract. Prior authorizations are required on HMO plans. That means testing, definitely surgeries, hospitalization unless it's an emergency. All those things have to be prior authorized with the health plan. I'll tell you, I'm going to show you in just a second what the doctors have to say about prior authorization, how it slows down and impedes your health care, especially the bad part is when you're in pain and you need a surgical remedy or you need something done in the hospital. If they put you off because of prior authorization for 5 or 10 days, that's a real big problem that will impact you in a significant way. The referrals are required too. If you want to go to see a specialist outside of your primary care doctor, you got to get somebody's permission. And most of those plans are zero premium. That's why my mom always said sometimes you get what you pay for. Zero premium, but they control your healthcare decisions, your access to healthcare, and what you get in the healthcare world. Two other distinctions here. On Medicare supplements, you can change those plans and sign up for them and cancel them anytime you want to, any time of the year. Again, depending on your health. If you want to get into a Medicare supplement plan and you didn't have one before, you may have to health qualify. If you're not in your open enrollment period, that is brand new to Medicare. So if you have a Medicare supplement now, we always run into people who have Medicare supplement plan F from 10 years ago. They're paying an astronomical amount of money and they shouldn't be. They should allow us to change that plan for them, at least see what those options are. We can do that all year long. Most agents don't even know that. On Medicare Advantage, there's one time per year that you can sign up for a Medicare Advantage plan. And in so doing, you have one time a year that you can change plans too. On a Medicare Advantage plan, there is no health qualifying. And like I said, most of them have no charge whatsoever. So during the annual election period, that's when your TV is barraged by all these advertisements out there. That's when they want you to sign up for your Advantage plan for the next year. Whatever you sign up for during the annual enrollment period will kick in January 1st of the next year. That's the same for Part D drug plans as well. Medicare Advantage and Part D have the same enrollment rules. Now, there's another period of time called the Medicare Advantage open enrollment period, but it's not really open. I call it the disenrollment period, which is what they first called it when they had it out the first time. That is between January 1st of the new year, once your new plan's kicked in or your old plan just renewed into a new plan. January 1st to March 31st, you can change your mind and change your Medicare Advantage plan, or go back to original Medicare, and first you'd better get a Medicare supplement before you do all that. And we go into that with all the people that call us. We make it step by step so that you don't do the wrong thing out of order. That could be catastrophic. So those are the two periods of time where you can make a change to a Medicare Advantage plan or sign up for one. You can't just join one whenever you feel like it, unless you're brand new to Medicare and that's got your open enrollment period. So this is a recent survey done by an organization that actually helps seniors with Medicare as well. And it showed that 4 in 10 people on a Medicare Advantage plan don't understand what they have. Interesting, huh? How is it that 40% of the people on a particular plan can't understand what they have? Well, let's get into it, shall we? It says a new survey found that 4 in 10 Medicare Advantage customers mistakenly believe that they don't have to stay in network for care, which is a key difference between the program and traditional Medicare. That's what I've been saying for 12 years. The survey was released Tuesday, which helps Medicare enrollment. Okay, It comes as the Medicare Advantage market has increased in size and become a lucrative option for insurers. Not for you, for the insurance companies. A key difference between Medicare Advantage and traditional Medicare plans is that Medicare Advantage plans require customers to only get care from physicians in the plan's network, whereas traditional Medicare covers any physician. That's not true. They cover any physician that participates in Medicare. That's an important distinction that they should have put in this article. However, the findings appeared to contradict a similar response rate where 8 out of 10 said their understanding of Medicare Advantage medical coverage was very good or good, while 14% said it's fair. Of that little side caveat here from having worked in the industry with thousands of people, it's the 14% that said it was fair. Those are the people who've actually experienced what it's like to go through one of these cycles of prior authorization and denials and appeals and all that. So everybody thinks Medicare Advantage is terrific. I'll tell you right now, I know this for a fact because we see them. They want the cheap plan, they want the free plan, and then something catastrophic happens and they call us right away saying, oh my God, I'm getting a copay of $100 a day in the hospital, or $250 a day, or $500 a day. And then I've got follow-up visit, copay, and then denials of care and claims. And then they want to go back to original Medicare where there was none of that. Just, you know, sign my way, I'm going to the doctor, get out of my way, I can go. That's what happens is once they discover what a bad situation in health does, that's when they're impacted enough to actually look at this and see what would happen in a worst case scenario. The article continues, but some Medicare Advantage members are switching back to traditional Medicare due to issues such as claims refusals. It found that 11% of respondents left Medicare Advantage because a plan didn't authorize a procedure, while another 11% said they were billed for an out-of-network charge. If you go out-of-network on an HMO-only plan, you're going to be paying 100% of that bill. There's no repricing. There's no going toward your max out-of-pocket. It doesn't help you in any way. It's completely unauthorized. So you're on your own if you go out of the network on an HMO plan, unless it's a life-threatening emergency. Another 10% said it was due to skipping a procedure, and 8% because a claim was refused. The survey results come as Medicare Advantage continues to grow in popularity. 45% of Medicare enrollments, and showed that there's a continued migration from nonprofit Medicare Advantage plans to for-profit plans. I want to share with you just a little study that I was the only one to talk about on the internet from the Office of Inspector General as he looked into the Medicare Advantage claim denials. That's when someone needs a big thing done and they're denied, repeatedly denied. And this study, I'm going to link on this website that I made just for your viewing pleasure, called allaboutmedicareadvantage.com. All about it. You want to know about Medicare Advantage? Go to allaboutmedicareadvantage.com. Now, in full transparency, my shop will help you with a Medicare Advantage plan. We do those, but we're not going to push you into anything. And I'll share with you in a minute why all the agents that you're talking to out there, especially if they knock on your door, are pushing only one side, and that is only Medicare Advantage. I'll show you why that's happening. But let's look at this report real quick, and you can download the whole report from my website, allaboutmedicareadvantage.com. Just in the background of this report, this is page 4. I want to zero in on this where it says, this is the Office of Inspector General writing this, a central concern about the capitated payment model used in Medicare Advantage is the potential incentive for insurers to inappropriately deny access to services and payment in an attempt to increase their profits. Interesting, isn't it? Now, a capitated payment model means that the doctor gets paid whether you go to them that month or not. They're getting so much per member per month because you're assigned to that doctor. So the less time that they see you, the more money they make because they make the same amount of money whether they see you or they don't see you. So again, it says in here, based on this payment model, there's the potential incentive for insurers to deny care, inappropriately deny care. Interesting, huh? Under the capitated payment model, beneficiaries enroll in a managed care plan. That's the HMO, that's the Medicare Advantage. They don't call it managed care, though. If you'll notice the marketing materials, they just say freedom and all-in-one, all-inclusive, everything together. We'll give you a free robot dog. We'll give you a free ride. We'll give you free meals. We'll give you free air conditioning.
At no extra
Nobody
cost.
looks at the small print for some reason and tells you the other side of the story. Interesting. In exchange for the monthly payment, the Medicare Advantage organization agrees to authorize and pay for all medically necessary care for the beneficiary that falls within Medicare's benefit package. Medicare Advantage organizations that inappropriately deny the authorization of services or payment to healthcare providers who care for the beneficiaries may not only contribute to physical or financial harm, but they also misuse Medicare program dollars that CMS pays for beneficiary health care. Interesting. Even low rates of inappropriately denied services or payments can create significant problems for many Medicare beneficiaries and their providers. What this study goes on to show, and I really encourage you to read it, is that when Medicare Advantage plans deny care and a person goes out there and files an appeal, that denial is overturned on behalf of the beneficiary 75% of the time. So the Medicare Advantage plan will just routinely deny care. It says in here the profit is the motive for that. Deny care, and then 75% of the time that someone appeals, it's overturned. Now, guess how many people appeal those denials? It says it in the study. 1%. 1%. So if you're making money every time someone doesn't get care, and you just routinely say, no, your care is denied, and then 99% of the people just go along with that, that is huge money, folks. They just don't even have to pay for that treatment. And therein lies the problem, and therein lies the profit. The other part is prior authorizations required before you can even get to the part where you would have the procedure. And let me share with you here what the doctors have to say about prior authorization. Again, remember, it's in red. It has to do only with Medicare Advantage plans. Here's what the doctors have to say.
Prior authorization is a nightmare.
It cripples my patients, it cripples my medical practice.
It takes a lot of the joy out of medicine.
The amount of time that it takes myself and my office staff to go through that process now for almost every prescription we write has gotten to be an enormous problem both for us and for our patients. They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.
Dealing with prior authorization is just a disaster, both for physicians, but more so for the patients. They're put in situations where they're not sure whether they're going to get their medication, they're not sure whether they're going to be able to have a test.
It takes time away from other patients. It frustrates physicians endlessly. I would hope that patients would recognize that doctors and patients are really on the same team, that we are as frustrated with this as they are. This is a great opportunity for patients and physicians to work together.
So, in their own words, that's what doctors have to say about prior authorization as it applies to Medicare Advantage plans. Now here, I saved the best for last, and if you go on monster.com, that's a jobs board, or indeed.com, look in your area and see what the jobs for Medicare agents have to say. And you will then find out what's happening on this side of the world, that's where the insurance agents are, and what they're all being taught, and why they're being recruited, and what they're being recruited to, and what they're being trained on. Here's one from an organization, just pulled this off 5 minutes ago. Here's the job description. If you're looking for a new career, you should consider Medicare insurance sales at Medicare Made Easy. We work with all the major A-rated carriers. Just to name a few, our top producers make over $100,000 a year here, while the industry average is somewhere around $50,000 to $60,000. Medicare Advantage plans have been gaining a lot of popularity in recent years, according to CMS, and a person who's not even an agent doesn't even know who CMS is, but according to CMS, 24 million people with Medicare enrolled in Medicare Advantage plans for 2021. Our agents are highly skilled at not only educating our Medicare recipients on how Medicare works, except for the supplements. They don't talk about supplements, I guarantee you. But also helping them select the richest plan, Medicare Advantage plan, available in their area. Medicare can be very confusing, especially if you're only telling one side of the story. And with so many options available, Medicare beneficiaries now need more assistance than ever when selecting a plan. We have a tremendous amount of resources in regards to training, the best leads in the business at no cost to you, and team collaboration to help you become successful in the industry. Although it's written on a third grade level, this is just indicative. I'll tell you, I talk to brand new agents every week. They join our training site called MedicareAgentTraining.com. There's not been a time, at least in the last 3 months, where a new agent has not come in asked for a consultation with me about getting started in their business or taking their business to the next level, where they did not say the following: "Hey Chris, I found you on YouTube. You're the only one talking about Medicare supplements. Why is that? My training, while I was recruited through Indeed or Monster or Jobs Board, some other thing, I was recruited over here, and the only thing they told me was, I need to take the AHIP test so you can sell Medicare Advantage, and I need to show Medicare Advantage, and here's all your options." They have them hanging out in food lines to get the people who are on Medicaid and Medicare, called dual eligible people. They have them chasing after people who are turning 65, doing seminars, paying for dinners, doing all these kind of things, chasing people who are brand new to Medicare because they can only do Medicare Advantage enrollments. And then suddenly someone lifted the scales from their eyes and they can see that, wait a minute, a person can be on original Medicare? They're not even trained on the fact that there's original Medicare as an option. Doesn't that sound bizarre to you? That when you can look at the Medicare and You guidebook, it clearly shows in there. You can do original Medicare with a Medigap plan. You could do Medicare Advantage. You go down one path or the other. They're not the same. And the result of making the wrong decision here could mean that you're forever banned from getting a Medicare supplement. If you get on one of those conditions past your open enrollment time for yourself, it's individual election period, when it's too late and you can't get back on original Medicare with a Medicare supplement. So it begs the question, if people are being recruited into the industry, trained in only one of these as an option, you're not getting the option then. You're not getting the education unless you're out there doing it yourself, educating yourself. So I'd ask you a favor, as the lone voice in the wilderness. Do me a favor, do yourselves a favor, and anybody that you know that's coming into Medicare, please share this information with them. Because I'll tell you that the appointment that they're going to see the in-person agent down the street, and people, before COVID, thought that there's some magic in sitting across the desk from an agent because they think they'll get some kind of increased, enhanced level of personal service. That could not be further from the truth. We've helped over 10,000 people across the country figure out what plan's best for them. Because we're licensed in all the states, we can see all the plans. It's not a mystery at that point. But before literally anybody was doing it, we're helping these people over the phone, and they can see things on their screen and they can become comfortable with what the options are. Then they can take action knowing, because they saw all the options, they saw them all, they can pick the best plan for them. And don't you think everybody deserves to have the full story, both halves of this knowledge of good and evil? I mean, there's good on both sides. Some people can't afford a Medicare supplement plan. And I'm not trying to propose to you that everybody should be on a Medicare supplement plan. But by gosh, they should at least know that they exist. Their agent should at least let them know that there is an option out there. I'm going to ask you a favor. Please share this video with anybody who's considering their Medicare choices before it's too late. Because 6 months after their effective date on Part B, their option to get a Medicare supplement may be too late depending on how their health changes in the future. The unfortunate part about, I started my career doing life insurance, and when everybody calls you wanting life insurance, it's because they then got a diagnosis that then pre-qualifies them to not even be able to get life insurance anymore. So by the time that you need homeowners insurance, if your house is on fire, it's too late to buy homeowners insurance, if you follow me. The same can be true about a Medicare supplement plan. Your option to get one, if you're on a chronic or a horrible condition or something just major just happened to you, it may no longer be there. So I'd encourage you to get the full story. See what those options are. You may think that they cost too much. You may have looked on a state website and saw, oh my gosh, those figures are horrible. I can tell you right now, the states and certainly Medicare do not maintain current information on Medicare supplements. I pay over $2,000 a month for a quote engine that has real-time daily updates on who is quoting what is out there. And if you get a plan in from one company, yes, it'll be the same plan in benefits across the country, no matter which company it was. We do a lot of research beyond just the rate, though. What is that company going to do if you need to change your bank account? If you move, you want to find out about a claim having been paid. Do they outsource everything through a third-party administrator that's horrible to deal with? We know if they do, and we don't recommend those companies. Or do they themselves maintain their own American-based customer service people? That can answer your question and get your problem solved right away. Those are the companies that we represent. So if we can help you, please let me know. I think I have a phone number on here somewhere. The biggest tip I can give you, subscribe and hit the notification bell so we can tell you when, or YouTube can tell you when future alerts about things happening with Medicare come out. And please share this information with somebody. If you've not subscribed, please do so. And our phone number is right there if we can ever help you with your Medicare stuff. Have a great day. God bless you. Bye-bye.